We'll begin the panel with each panelist introducing themselves by using their names and institution, and then we will proceed to the questions. Dean Van Sluyters, will you please
Sure.
begin?
So my name is Richard Van Sluyters. I'm the Associate Dean for Student Affairs at UC Berkeley School of Optometry. My responsibilities include not just admissions and recruitment, but also all student affairs after you're admitted to Berkeley Optometry.
I'm Dr. Ann Munroe, Assistant Dean of Admissions for the Southern California College of Optometry, and I practiced optometry for 30 years, being a 1977 grad of that program. I hate to say that out loud, but now I'm back and pleased to help young people like you achieve their goals.
My name's Justin Griest. I'm at The Ohio State University College of Optometry and work with our admission and financial aid process. So meet with all of our students as they come through the admission process, recruitment, work with all of our current students with their financial aid needs, and really anything else that you come to our office for. We're always there to help. So nice to get to talk to you today.
Hi everyone, my name is Gui Albieri. I'm the Senior Director of Admissions and Marketing at the State University of New York College of Optometry that is located in New York City, Manhattan. And my responsibilities is admissions, marketing, and also international programs at the college.
Good morning. My name is Sunnie Ewing. I'm the Director of Student Recruitment at Southern College of Optometry in Memphis, Tennessee. I work in the admissions side as well as recruiting and also in the scholarship committee.
Okay, so for the first question, I would like to direct this question to everyone on the panel. So we'll just begin with Dean Van Sluyters and then move down the row. Is that okay? Okay, the question is, what is your program's competitive advantage?
Wow, that's a broad question. I should start by saying I think that there's no one school that's the best school for all students. And I think your job as a student is to do things like today. Come to workshops and visit schools and find the school where the fit is the best for you. If you were here for the last presentation, you heard our dean describing our program in some detail. The program at Berkeley is old, it's well established, it's well attended. We have a very, very large clinical program. We also, of course, have a research program at the university. I think it's important for people to realize that there is no research component to the optometry training, no mandatory research component. It's just there if you wish to do it. And so I think that people who are at a university and are considering staying in a university should definitely look at schools like Berkeley, like Ohio State. People who are at a university and are thinking they want to leave the university and go into a smaller environment might want to look at private schools like Southern California College and other places. So I think you should do due diligence and gather all your facts before you make up your mind about the best program for you.
We're known for our clinical program. We have, in your fourth year as a fourth-year student, you're done with all your training, lecturing, didactic education, and you go out on one of 4 3-month rotations. And we have 80 sites all across the United States in which you get to choose what kind of rotation experience you'd like to have. There are military bases, veterans hospitals, private practice, co-management, and what this variety does, it allows you to tailor your last year's education to meet your interest in optometry. It's a huge program, and when you go to a school, you rely on them to be able to round up as big of a diverse patient population as possible, so you can have all the clinical experience that you need to have, and we can offer that. The other thing that I'm proud to say, we're converting to an interprofessional institution, interprofessional education. We've added our first class of PAs, and in 2016, we're adding pharmacy. And as strategizing for the coming age with healthcare, the way it's changing, you're all you're requiring to work as a team and work with other professionals, and it involves understanding how to do that and how they problem solve and approach patient cases. And so we're converting to an interprofessional environment for your clinical education for the future as well.
And kind of piggybacking on that, interprofessional education is huge. And you are all going to be part of a healthcare team. We hope that part of the healthcare team is working with optometry, but you are definitely a part of that team. And there are many players on that team. And at our university, we're blessed to be right there in our health sciences campus. It's a 4-city block area that includes the College of Medicine, dentistry, pharmacy. Vet med's a little further off. You're not working with the humans there. But we also have OT, OPT, and we have our medical center right there with hospital beds, about 1,000, a helicopter pad, heart hospital, cancer hospital. It's a very vibrant, real-world situation for you. So you're working in the clinic there, right near all these other folks, and you're working with folks in the ophthalmology department. There's a lot that goes on with interprofessional education, and we continue to look at ways to have our students work with the other students and other faculty to learn about what's more out there, how we work with those teams, and then you can go in that real-world setting when you're done with school. So we really like that environment. We're small. We have a class size of 64, and some of our students tend to like that, and it really gives you the opportunity to work one-on-one with your faculty. It is actually one student, 2 students to 1 faculty member when you get into the clinical setting, so they tend to like that option. Our business management program has been solidified as a great option for our students that are looking to then go on to practice practice management. So we really use that as a great model for our students, where your final paper is actually a task to put together a business plan to start your own business. So you'll be tasked with those skills. So those are some of the things that I would say maybe set us apart from some of the other institutions.
Hi, at SUNY Optometry, I think one of the major advantages that we have is being located right in the heart of New York City. It's a very vibrant city. Of course, that if you appreciate and enjoy city environments, if you do, I would definitely encourage you to consider us. The advantages of being such an environment is that we have something that's called the SUNY patient. The SUNY first of all, our clinic, we are located on 42nd Street between 5th and 6th Avenues. And we attract a lot, we have about 8 million people living in New York City. We attract a large population of very diverse cases. You have not only ethnical diversity in the community there, we also have a huge diversity of different conditions that you, as a student, will be able to examine and treat. So I think that that's one of the major distinct points that we offer in our program. Also, you know, just the excitement of living in a big city where there's a lot of culture, there's a lot of, if you like, the arts, food, you name it. There is something for you in New York City. Also, it's a very rigorous program. It's a very selective program, and you're going to be surrounded by very, very intelligent and capable students, which I think always you get a kick out of it. You get an extra motivation and an extra push to work harder. And we have a major focus on career development and building the professional of the future, a professional that can work in collaboration with other healthcare professionals. One of the goals of our president is to make sure that in 5 years after graduation, you are at a position of leadership in whatever mode of practice or specialty you choose for yourself. And through that, we have a number of programs. We have a mentorship program where you can connect with doctors, almost like how many of you have LinkedIn accounts? It's almost like a LinkedIn account where you read different profiles of different mentors, and then you choose who you want to work with as you progress through the program. And that has been very successful in getting you to think about not only your years as an optometry student, but also as a future emerging professional.
Well, we are a little bit different. We are an independent school that is not connected to a university or any other degree programs. We only have a Doctor of Optometry degree, but we do interact with some of the other health profession programs in the city. I think one of the things that our students really appreciate about that is that they are being taught by optometrists in the classroom, and they're getting a good feeling of what kinds of material they need from day one in the program. That's one of the things I get from our students. We are also in Memphis, Tennessee, which, if you've ever been to the South, one of the things we like to do is be very unhealthy, so you get a really good patient base in the eye center. We have About 140,000 patient encounters each year, so a very large number, as well as the quality of the patient base being very strong too. So a very strong clinical education when you graduate.
Okay, this next question is for Dr. Albieri. What do you recommend potential pre-optometry undergraduates do to polish their applications?
What can you do to polish your application? Very good. Well, there is a lot you can do to polish your application. There are certain things that, depending on where you are right now in the process, you don't have a chance to work on it anymore, like your GPA, for example, right? But again, if you are a freshman and you're a sophomore, work hard on your GPA. For those who are taking the OATs, work really hard on getting a good score, because most of the time, these are the first things that we see, okay? We're going to see your GPA, your OAT. We have an overall view of who you are as an applicant. We place you mentally on a bell curve there. And then I'm going to look into your experience. I think, and some of those who were in our workshop earlier, yesterday, you saw how much emphasis we put on actually describing your shadowing experiences. In OptumCast, the centralized application system, you have a field there where you will talk about your work experience, your optometric experience, your shadowing experiences, and you have about 600 characters to describe your experiences under each category, under each doctor that you have shadowed. So use those fields. Be reflective about your experiences. And as I mentioned yesterday, some students will write down, oh, I shadowed this doctor for 1 day on his private practice, and that's all the student will write. On the other hand, you have your competitor, your fellow student, who is writing beautiful descriptions of what they saw, how that made a difference on how they perceive the profession now, how they appreciate that particular mode of practice or that specialty. So don't save words. If you're giving 600 characters to talk about your experience, use those characters and be reflective about whatever you put in your application. Your essay, work hard on your essay. I think that a lot of times you have to be very careful, because there's a major distinction between an undergraduate essay and a professional school essay. Students tend to be very, sometimes begin their essays with very cute stories, close your eyes, open your eyes. And then I opened my eyes, and now I could see again, and that's why I want to be an optometry student. And I read that like 500 times, like, please, not that again, So try to be different and go for the punch, Why are you a major asset to my program? And sometimes you spend 3 paragraphs telling me this little cute story that doesn't tell me much about you and how you're going to add value to my campus. And so when you're crafting your essay, when you're crafting your application, always think about those things. Really what I want to get an idea is, how much first of all, are you going to be a good student? Second of all, how much do you know about the profession and your motivation to become that professional, okay? And it needs to be a little deeper than what we sometimes tend to see. So be very reflective about the things that you put. Anyone would like to add to that?
Well, I like the word he used, reflective. I use the word contemplative. It's so important to take experience that you have and put them back through your own filter and how they resonate with you according to your hardwiring and your goals and objectives about what you have for your life. When I talk about shadowing, you need to take your shadowing experience and then, to build a story. We want to see your passion. We want to see your commitment. We want to see the motivation that's going to get you through 4 years of a tough professional program. And if we can see that as a result of your shadowing, then your shadowing did the trick. So many students will come and say, Dr. Munroe, I've shadowed 60 hours. Is that enough? I say, well, what's your story? I got to hear, what is that distilled in you, the drive, has that given you the motivation to get through the program? Do you feel like you want to be one of us? Do you want to be a doctor? You want to join our ranks? So, when you go through these things, just be reflective, contemplative, and distill it down into an experience, and think of yourself like a future doctor and how, you would reflect on that experience.
And that's a very interesting point as well, and relates to in our application, we have a question about your leadership skills and qualities, and a lot of people would just list attributes that they have, skills that they have, or we'll just use adjectives like I'm a good communicator, I'm a great leader, etc. And that doesn't mean much. And like my colleague here just said, Dr. Munroe, you have to attach a story to it. What is the evidence that you can provide in your application that actually shows that you're a good communicator, that you're an innovator, that you're a good leader? So always have a story or an anecdote to back that assertion that you're making, that you are a good communicator or a good leader.
Thank you. Would anyone else like to elaborate?
Don't be shy. Don't be shy. This is your time to shine. Many times people aren't comfortable with telling all those things about themselves. But really the application is your chance to do that before you could get an interview. That's the way that it goes. It's our first opportunity to see you. So you'll want to fill that thing out as much as you can. Don't leave things blank. You know, the folks that leave things blank and maybe are very similar to someone else that filled out the whole application with good ideas and good thoughts and good input about themselves, that person that did all those good things might have that opportunity over the other.
Yeah, I think I would add that the students I talk to who are applying to optometry school, especially to Berkeley, think that a high GPA and a high OAT is really all they need to worry about. And if they have a high GPA and a high OAT, it's automatic. And nothing could be further from the truth. It's the subjective part, the qualitative part of your application that's extremely important to us. We do look at your academics. We look at them very early in the admissions process, and we use them to help us determine who to interview. But we interview many more people than we're going to admit. And after that initial look, we don't look at your academics again at all. Everything that determines whether you get in has to do now with the subjective part of your application, with your performance on interview day, which is a day-long event at Berkeley where all students are interviewed on the same day. So we see you all in the same setting at the same time with the same experience. So we have a nice way then to compare and contrast among applicants. So if you haven't built that into your application, if you haven't prepared for that kind of interview experience, then you can have very high academics and not be admitted. We have not admitted many times people with 4.0 GPAs and 400 on the OAT. You could not do better than that, and those people have not gotten in, simply because they were not well-rounded people. They're not the kind of person you would want to have as a doctor. They have no personal skills. And we have admitted, last year we admitted a woman with a 2.65 GPA. Right. People would think, no, that's impossible. Why did she even apply? Well, she had a compelling story, very compelling story, compelling enough that I and the dean of the graduate school at UC Berkeley both thought she should have a chance to become an optometrist. So you have to be very careful not to misemphasize things that you might think are important and overlook some of the things that I couldn't agree more with my colleagues here are extremely important to us. We're picking doctors, not physicists. So a large part of what you have to be is a person capable of being a caring, compassionate, well thought out, problem-solving person. And that's related to your academic and intellectual abilities, but it's not a one-to-one relationship. It's not a really tight relationship.
And I would also say, don't be afraid to ask questions yourself, because if you've taken the time to explore the programs and ask intelligent questions, it lets us know a little bit more about your true interest in the field too. So lets you know that you're really interested in us and what your profession is.
Okay, thank you. This next question is for Ms. Ewing. What are some common majors you've seen in the applicants, and were there any particular majors that stood out?
About 60% of our students come in with a degree in biology, but the other 40% really range from a large, my favorite major of our first year class was like fire protection and something along those lines. I was like, how does that relate to optometry? It didn't. It was just something she found fascinating, and she really enjoyed the material while she was there, but she was taking the prereqs because she knew what her career goals were. So I always say you want to major in something that is truly interesting to you, but you want to be able to relate back to what your career goals are too. So major in something where you're going to be able to get the prereqs, but also be a well-rounded person. They were talking about being good doctors, and good doctors are well-rounded people having a wide scope of interest. So just major in something that's going to be interesting, but also productive for you.
Okay, thank you. This next question is for Mr. Justin Griest. What type of extracurricular activities are sought in an applicant?
Well, this is pretty wide-ranging. We like to see folks that have challenged themselves. When you look at the curriculum in optometry school, one of the big changes from undergrad to optometry school is just the sheer number of courses and hours that you'll be participating in. Extracurricular involvement can be a true addendum to your academic component in undergraduate studies. It can show us that you're tackling this as a club leader and this as a volunteer in a hospital, and also keeping great grades with 18 credit hours. And then you come to optometry school and you have 25 hours. So extracurriculars can show us that aspect of things. It can show us leadership. It can show us compassion, good manner. We really like to see folks that are out there, and helping someone is kind of the hallmark of things, obviously. But this is a profession where you're doing all those types of things. And it's only going to stay true when you become in optometry school and join all the other extracurricular involvements that you could be a part of at that stage. But really, extracurriculars, they show us another component of you as well, outside of just the academic piece. So the more you can do and the more meaningful things you can do, don't become a president of a club just to become a president of a club. Do it to take on that leadership role, to change things because you want to. Don't just beef up your application because we want to see these things. Truly go for it with your passion.
Would anyone else like to elaborate?
I think that the word meaningful is very important here, because I see a lot of students who suffer from FOMO, the fear of missing out. How many of you suffer from FOMO? Like, you're a joiner, you join every club on campus just for the heck of it, you know? And that's really not the case. You really should be purposeful about it and do it because you like what you're doing, because you care about it, and not just to check a box. The other day, I don't remember where I was, but I talked to this student, and he said, "Oh, I have managed my GPA pretty well. I'm ready to take the OAT. Now I just need to join a club." And my reaction was like, oh, really? I mean, it's just to check a box, and that's not the point, okay? So really do something that's meaningful to you. Don't worry about joining 15 different clubs. Join one or two, but that's something that's close to your heart, because you have to be able to talk about it as well if you're asked. Why did you join? What did you learn from it? And you have to be reflective or contemplative. My Portuguese nature doesn't allow me to. That word is hard for me to. Reflective.
So this question is for Dr. Munroe. What should students know about reapplying?
Oh my goodness, this is one of the most common things I need to dispel this question is you come in and you hang your head like you're wearing this big scarlet letter like I'm a reapplicant. No, for goodness sakes, if you take that, you can take any negative and make it into a positive, and this is definitely an example of such. You are back because this is what you want to do. You have a desire, you see your 10-year, your 5-year, 10-year plan. It says it's screaming optometry, and you're dedicated to your goals. I think the only thing as a reapplicant, we will ask you, what advice were you given, and what steps did you take, during this term that you prepared as a reapplicant, to improve your application and be a more competitive applicant. The reapplicants that we ask that question to, if they say pretty much, I just took a couple more classes. No, you have to go about it in an intentional way. Good doctors they solve problems. They strategize. They have plans. They have plan A and plan B. So as a reapplicant, you're on plan B. And if you've got a plan and it's solid and you've done everything you can to follow that plan and reapply, you should go in there and actually, I would declare it right up front. I'm a reapplicant. Our interview panelists do not know if you're reapplying. That's up to you. But I would just state it up front because I think it can be a position of strength if it's handled well.
Yeah, go ahead.
So Everything that Dr. Munroe said is absolutely correct, and it's competitive, and sometimes students will apply to just a narrow selection of schools the first time and might not get into the school they want to get into, or not get into any school. And so I think if we see a reapplicant as someone who really wants to be an optometrist, someone who's willing to swallow their pride and hitch up their boots and go. Now, I will tell you, if you apply to Berkeley and you don't get in, I don't know if the other schools do this, but we will actually tell you why. You may call us and during the summer after admissions, and we will read your application, read the remarks that were made by the admissions committee, and tell you exactly why you were judged not to be as competitive as some of the other applicants. Knowing that, if you then take that information and improve the things that we viewed as being less than competitive, automatically you must be better in the next go-round. There's a doctor who practices a block from this campus who applied 3 times to get into UC Berkeley and was waitlisted the 3rd time, number 10 on the wait list. The day before class started, someone had a family illness and dropped out of our class, and a spot opened for this guy. And he was admitted the day before classes started. And he came to Berkeley, and he graduated as president of his senior class and gave the speech at commencement. He was selected by the entire student body to be the speaker for all the students. Why was that? I mean, were we just crazy? Why didn't we admit him the first time? No. Each time he was not admitted, he worked hard to make his application better. And it was really pretty bad the first time he applied. He didn't even get an interview. So that kind of progress and diligence was rewarded. And in fact, I think was part of the reason why he did so well. His approach to solving that problem, to fixing what was wrong so he could get in, served him very well once he got into optometry school. So yeah, there's no stigma attached to being a reapplicant if you've made yourself stronger.
Would anyone like to elaborate? No? No? Okay, so this is a follow-up question. Is there a limit to the number of times in which students can reply?
So I will tell you that I had the pleasure of calling that applicant on his cell phone at the day before class started and asking him if he still wanted to go to Berkeley, and he said absolutely, and I heard him turning his car around. He was actually in Davis, and he's headed for Berkeley as we were talking on the telephone because he had class the next day, right? And I got to know him very well, of course, and I asked him, well, what were you doing, not driving your car, but what were you thinking about, when I called you? And he said, oh, my application was all set to go. I was ready to send in my 4th application.
Oh, that's a great story.
Yeah, and there's no limit.
Calls.
Are reapplicants evaluated differently?
Yes, so I don't know about the other schools, but we actually ask you to self-identify as a reapplicant and to tell us specifically what you've done since your last application to make yourself more competitive. What have you done to address what were viewed as weaknesses in your application? And so you're not at a competitive disadvantage. You're identified as a reapplicant, and a lot of the evaluation of your competitiveness now for a spot has to do with how well you manage that problem. In other words, did you fix it? So there's no stigma attached to being a reapplicant, or you don't get marked down from the beginning in any way, but you do have that extra piece of being evaluated as somebody who's had a chance to get better, and you need to capitalize on that.
Okay, thank you. This next question is for Mr. Griest. What are some examples of red flags in applications?
Well, red flags in applications. Let's start with one that should be pretty elementary for everyone, grammar. Okay? You need to have that essay checked by at least 2 or 3 people and use word perfect for spelling issues. I can't tell you how many times I've seen grammar issues on essays. And if you've put as much time into the application as you should, that's the number one thing that should be right, is your grammar. And don't use text speak like LOL or things like that. Believe it or not, yes, we see that in applications for optometry school. We're not joking. That's kind of the number one thing that is so elementary that you can fix to be put together. Now, some other things, when you're going to look for letters of recommendation or letters of evaluation, one thing that would be very smart for you to do would be to ask this simple question: are you willing to write a positive letter of evaluation for me. I know it sounds simple, but there are people that you ask them, and sure, anybody could write a letter of recommendation if they've met you once or twice, but will they write a positive one? And a real red flag for us when we're reviewing files is a not positive letter of evaluation. We expect almost all of those letters to be positive, and if there is some kind of a mark against you with a letter, it can surely raise a red flag as to why, and you ask that person, and you've known them. So keep that in mind as a few red flags that I could mention, and colleagues, if there's more.
I would like to mention one. Negativity and talking about obstacles that that plague you, I think in a way applicants disclose too much, and they think they're trying to justify why they behaved a certain way. But when you are like, for example, I had a really bad second year in undergrad because I broke up with my boyfriend. It was like, well, life is gonna, we get these all the time, and I'm sure my colleagues would say that too. And I think you go about it in a way of trying to explain why you had such a bad time, but realize life is going to continue, and those kinds of challenges are going to persist. So, negativity and being caught up by challenges that you can't meet. And yes, there are devastating personal things that happen to people. And then we want to hear your story about how you overcame them. But this kind of me perspective that all these bad things happen to me, and I'm, things are different now. Well, life is not different. Life goes on. So be the kind of person that's positive. And then the other thing I would say, a red flag, is if you show any problems with stress or time management. That's another way that students want to justify behavior in essays. And you're always positively managing your stress and your time, and all the juggling the challenges of life. And but sometimes they use personal essays for platforms to air those things out, and even in really subtle ways. And that's always a red flag for me, because life just marches on. So it's always onward and upward in how you overcame those challenges.
The more would be probably a lot of withdrawals. If you start out with 18 hours and you drop down to 12 almost every semester, kind of red flag. How are you going to handle 20 plus hours in an optometry program? And then also big gaps of time missing. You took time off from school for a year or two, or maybe you graduated, but there's no explanation in your file what you were doing during that time. Explanations, not excuses, is always helpful in giving us a little bit more clear picture of your past, basically.
One thing I would mention too is prerequisite courses. So I think we may have more prerequisite courses than other schools do, but we look at the extent to which you've completed those prerequisites. You needn't have completed them all at the time you apply, but you have to have a doable plan, a believable plan for completing the remaining prerequisites. And practically speaking, given when the applications come in and the fact that you're applying usually as a senior, that means that you need not have more than 3 or 4 outstanding prerequisite courses. Otherwise, we're not going to believe you'll be able to finish them. And that leads to what I think is becoming more and more a problem. And that is the applicant who applies, quote, too soon, unquote. Too many people are applying at a stage when they're not really finished with, or mostly finished with, their undergraduate education. They haven't had enough time to really study for and do well on the OAT test. They've crammed a lot of courses into their last year so that they finish up really on time, and they're just moving on to the next thing without really thinking about it. About a third of our applicants take a year off after college, and during that year they do something that they've always wanted to do. They don't neglect optometry. It might also involve maybe working, even for money, in an optometry practice. They take the OAT when they're not in school, when they have time to prepare for it carefully and do better on it. And they grow up. They live a little bit more independently than they did when they were in school, maybe even having lived at home when they were in school. And we view all those things in a very positive light. I can tell you that the people on the admissions committee that see someone who has some real life experience view that as a very positive thing. It also gives you more to write about. You've just heard about how important it is, all the things that are not academic and not related to school. You haven't had much time to live if you've taken gone to a rigorous high school, gone to a place like Davis, a rigorous university, and taken a full load of courses for 4 years, you've been on the treadmill nonstop. And so there's only so much you can do. I think that's something that's becoming more and more important in our eyes.
I agree.
Yeah. I don't know if my colleagues feel the same way, but we certainly see. Oh, and the other thing is that the people that have done that seem to make the transition to optometry school more easily. I think it's just that they got a chance to take a breath and to sort of, get reinvigorated. Also are sure that's what they want to do. It's not just I have to have something to do because I can't have a gap. That would look really bad.
Burnout is a problem in professional school. So if you do anything that hedges your bets against having a burnout experience, like taking a gap year, I want to add gap year. If you travel, expose yourself to a different culture diversity, cultural sensitivity, that's a really great thing that that's just as good as getting an education on any level. So, bring that out about yourself too in terms of a gap year.
Okay, thank you. This next question is for Dr. Munroe. What are some subspecialties optometrists can go into, and how does one subspecialty differ from the other?
Differ from the other. Oh, goodness. How much time we got? So, let me just name them off. Okay, we've got ocular disease, vision therapy. Vision therapy, the demographic for a vision therapy patient is usually a child whose eyes don't yoke and team and work well together, like if they have a lazy eye or a crossed eye. As a vision therapist, you not only I diagnose that problem, then you remediate the patient and you treat the difficulty. Low vision, it's starting to be renamed as low vision rehabilitation. These are patients with best correction glasses or contact lenses still do not have functional vision. And you would probably call them partially blind. That would be the way to describe them. But as an optometrist in low vision, you're going to get them rehabbed and back into the workplace or whatever their goals are, back into the place, back into school or whatever would be their objective there. We have pediatrics, that's self-explanatory, and cornea and contact lens. Cornea contact lens, usually it's more than just your everyday contact lens fitting. You're usually dealing with corneas that, some corneal diseases like keratoconus or post-refractive surgery, they end up needing specialty contact lens fits. So you direct your specialty lies in both cornea and contact lenses. And how do they differ? Probably the thing that I would say would be, did I leave any of them? I don't think I left any of them out. I'm going through our clinic and going boom, boom, boom. Oh, and primary care, that's one of them too. So I would say it kind of depends on the age of patient that you're going to end up seeing. Before I go into that, so we got two specialties within specialties. We've got sports vision. They're taking college athletes and have normally really good vision, and for example, and increasing their performance in the ball field. And so, just with using techniques that help their eyes interface with their brain better and produce better results. And then the other thing is traumatic brain injury. We have patients, a lot of soldiers returning from the war have had head injuries and where they've lost vision, and they have to be rehabbed and get back into the workplace. So all those ways you can serve. If I had to answer the basic question on how they're different, I would say it's the kind of almost the age patient you see. If you end up going into ocular disease or low vision, typically you're going to be seeing more of a geriatric population. If you end up in VT, cornea contact lens, not always, but typically you've got a younger patient demographic. And then past that, it's just your level of interest. If you're into more of like the neuroscience and the way the brain performs and sensory vision, that's going to be VT, vision therapy. But if you're into more ocular disease, which, I really love the study of glaucoma and ocular disease, you're going to tend toward that specialty. Did I do very good? Okay.
Yes. I would add community healthcare as a specialty area that's growing in importance. And I know Jane Ann just forgot to mention it. It's not that they aren't interested in it, but it's you heard talk earlier on about interdisciplinary care and whole patient care. And with Obamacare and with the changes in healthcare that are coming in California, I think you're going to see a lot more optometrists attracted to community health centers where they work in a multidisciplinary setting. To that end, at Berkeley, we have 4 of those centers that our students work in now. One of them is Spanish speaking. And you need to be able to conduct exams in Spanish to work in that center. And we think that that's for a certain group of people, that's a very, very exciting and interesting potential career. And I know it's growing all across the country.
Would anyone else like to add on?
I think what is very important about what they just said is the need for you to know that these specialties exist. I think that one of the first questions that you're going to be asked during your interview, at least as Sunnie, will be, tell me more about yourself, why you're interested in this profession. Then will be, tell me more about your experiences. Then you're going to start talking about the doctors you have shadowed and what specialties they worked with. And immediately the interviewer is thinking to him or herself, all right, you saw VT and you saw ocular disease. What about everything else? Then the follow-up question will be, what do you know about everything else? So you have to be able to talk about the profession as a whole. Maybe if your experiences don't allow you or don't lead you to get to know every single one of them, which is nearly impossible with all the classwork that you have to do in college and prepare for the OETs and the clubs and organizations you have to be a part of, you have to at least know that they exist and be able to talk about them at a conversational level. Not in details, but at least know they exist and be able to talk about them. And I'm always disheartened when you come to an interview and I say, so what else do you know about the profession? And your knowledge is only limited to your experiences. So write everything that they said and go online and do as much research as you can. Because in the end, like Dr. Munroe said, you're going to be joining a very exclusive club. And they want to make sure that you understand what entails to be part of that club. And one of the things is knowing what the possibilities are. What is the entire scope of the practice?
Okay, thank you. So this question is for Dr. Albieri. What are the modes of practices and what criteria should students consider before choosing a particular mode of practice?
Oh, mode of practice. I would probably defer this question to my colleagues here to the left.
I think you mean private practice versus
Right.
group practice versus, well, this is exciting because I can tell you, graduating in 1977, we just all hung our shingle and went into private practice. Optometrists weren't part of the medical strata, like when I say the health professional strata, we just weren't. Our professional organizations got busy after that time, and we got the laws changed. And when we got the ability to prescribe therapeutic drugs, we were now players in the HMO scene, and we were sought after. We have lower malpractice and premiums. There's more of us. We were just like a vacuum cleaner sucked into the scene. And that has changed so much, and especially in California, we didn't get the right to prescribe therapeutic drugs until the early 90s, so these are big, big changes. So now you have all these vistas that have opened up to you. Private practice, if you want to, meet the challenge of seeing patients and running a business, which I always loved. I did that for 18 years. That's really fun. I mean, you'll be reimbursed a little bit better too, I think, and because you're meeting those challenges. Group practice, a lot of doctors now are going into group practice because as we work more and more into medical, there's a lot more instrumentation and things pieces of equipment we want to own to see patients, and it just makes sense to share that overhead with someone else. You can go into hospital settings. That's what I did for 9 years. I was on staff at a general hospital. I worked with an ophthalmologist who was a head trauma specialist, and I did all of his general care, and I actually took call. If he got double call, I would sometimes go and take the call, and we would figure out where he needed to be first. You can be in administration. I mean, that's, my colleague mentioned that optometrists are moving into community settings where we're hospital administration and military. That's a great way to serve. Military have a lot of young families on military bases. Optometrists are in those settings. So there are so many ways, so many modes of practice now to choose from. And that's so exciting because it's so new for us.
Thank you. Okay, this question is for Ms. Ewing, Sunnie. What factors should be considered when applying to optometry schools?
What factors? Well, Basically, what kind of doctor you want to be is a first thing, kind of narrow down which schools you want to apply to. If research is important to you, like they were talking about earlier, you want to find the schools that have more research opportunities for you. If pediatric optometry is important to you, you want to focus on the schools that have those kinds of really strong clinical patient bases when you're going through those programs. So definitely looking at what kind of doctor you want to be or what kind of you think you want to be. It often changes from day one till the time you graduate, but that's one of the primary factors, helps you narrow down the schools. Location can be important to you. If you are someone that's close to your family and doesn't want to leave home, then you're going to look at the schools that are closer to where you are. But if you're looking for a program that gives you opportunities to go out and explore different communities and lifestyles, that's another thing you should explore too. We definitely talked about several criteria yesterday. It basically comes down to where you feel like you belong. And it's one of the reasons why it's important to visit those schools when you're interviewing and talk to the people while you're there and just find out if it's where you want to be for 4 years. If you feel like you fit in with the students there and you kind of feel like that's the kind of learning atmosphere that you want to be in.
May I just say something? I forgot to leave out one of the most important modes of practice, and that is academe faculty. Optometry is growing. When I started this position in 2006, there were 17 colleges and schools of optometry. We're up to 24 with a charter for one more. So we're growing at a phenomenal rate. And if you think you would want to go in to be an academe in optometry, being a professor or work in an educational setting, that's another great opportunity. And I would plan that ahead even as you were thinking about your education within a program.
Yeah, go ahead.
I want to follow up on the statement that was made about visiting. I find it really surprising that people apply to schools and wait until they're interviewed to visit the school. An interview is a very artificial situation for both the school and for you. I think it's a much better plan, even though it's expensive sometimes, to visit all the schools you're thinking about applying to if you can, and to see how you're treated as a visitor. I don't think you should just drop in and say, hi, I'm here today to visit your school. Make contact, arrange to come and visit, and see what the place is like in a non-evaluative type situation. You should be able to meet students, you should be able to go to class, you should be able to hang out and find out what the place is like. From that, you will either find that your initial impressions about the school are affirmed or they're denied. And then during the application process, you should focus on the schools that you think you're most likely to want to attend. Definitely apply to multiple schools, and if you're lucky enough to get into multiple schools, then you'll have the chance for a revisit. Now in a very artificial situation, right, in an evaluative situation. You're all dressed up, they're all dressed up, and it's a different, but again, evaluate the interview process. If you're interviewed at 4 schools, you get to see how 4 schools manage their interviews and how they go about evaluating you. That should be part of your decision too. So if you go about, gathering that kind of information, then the decision usually is a lot easier. It'll depend on where you get in. You'll be able to prioritize your choices, and you'll go to the school that has your top choice if you get in. So be strategic about that. A lot can be learned from visiting. Most of you are in pre-optometry clubs. You know people who've gone off to other schools. Call them up. Can I come stay with you for 3 or 4 days? I just want to hang out and find out what that place is like. Can I go to school with you? Would they let me do that? That sort of stuff. Find out. If a school says, no, we don't want to see you, then I take that as a very dim perspective on the place. Hey, I'm thinking about giving you 4 years and a lot of money. You should welcome me, right? And I mean, all the schools will. So it's not like it's a bad strategy. It's a good strategy. You also get to see what it's like in that community where you're going to possibly live. So definitely take advantage of those situations.
And I think sometimes you guys as applicants rely too much on social media and message boards on getting your information, and instead of finding your own opinions and finding out if it's truly what place where you want to be. So Everybody's got different backgrounds and different expectations, and you don't want to rely on someone else's expectations to see if it's where you want to be. So visiting yourself and take time to explore the cities. Don't just fly in for your interview that day if that's the only time you're going to be there. Don't just fly in for the interview that day and fly out that afternoon. Take time to explore the city and see where you might be for 4 years.
And to add to it, there might be some opportunities where the schools fly you out and have some accommodations for maybe a week or 3 days. I know there are some summer programs all across the country at several schools and colleges of optometry. So do some research on the websites, take a look and see what visit opportunities the schools have, and that might even get you there without paying anything.
Thank you. So this question is for Dr. Albieri. What are the available resources for applicants to find optometry-related internships?
Very good. One thing that I encourage my students to do is to call the college that you're applying for and see if they have lists of doctors. At SUNY Optometry, we offer you doctors that you can shadow. And I think that probably that's one of the easiest ways of finding shadowing opportunities. What happens is a lot of times students try to find shadowing opportunities on their own, and it's a very laborious process, and they receive a lot of no's before they receive a yes. And my advice to you is do what needs to be done. If you receive 50 no's, at one point you're going to receive a yes. So be persistent until you can find that shadowing experience. There are many other resources as well. You know, if your school has a pre-optometry club, that's probably the best thing for you to do. And just like my colleague here said that he is, and I said yesterday as well in the interviewing seminar, that I'm very disheartened when you live in Queens and you have never visited my university. The same thing is when you attend UC Davis or any school that has a vibrant pre-optometry club and you're not a member of the club. And like, okay, so where have you been? Or what have you been doing? So, you know, use your pre-optometry club as a resource. I've seen so many times pre-optometry clubs having programs that connect you with doctors in the local community, and also that bring in doctors to speak to you. So that's another major resource. And in terms of resources that are available to the public in general, you can use opted.org, opted.org, and that is a website that is organized, that is managed by the Association of Schools and Colleges of Optometry. The AOA has also some good resources, right? The AOA website. Would you guys? And each individual school also has a lot of different resources. Like at SUNY, we have the IDEA project, where we share a lot of different tools in how to become a competitive applicant. I know SCCO does a wonderful job with that. Berkeley, Ohio's SCO. So visit each school website and try to find out what are the tools available to you as well.
Go ahead.
I host a blog for optometry. It's optometryadmissions.com, and you can access a shadowing program that we have. We have many SCCO alumni that have agreed to participate as host shadowing doctors, and we'd be happy to give you the flyers and kind of the protocol for the problem, and then just give you all the doctors' names. We have a lot in Northern California. And the other tip I have for shadowing, if you call a busy optometrist's office and get the front office staff and say, I'd like to come in and shadow, you're gonna probably get the turn down. They're busy, and so this is the way you should go about it. You should write an actual letter, yes, a snail mail letter, and address it to the doctor. And I would put personal on the bottom of the letter, because otherwise front office staff open letters and they might, again, they're really busy and they don't want to necessarily take time out to host shadowing students. But if you put personal on there and then write the doctoral letter and include your picture, it's always really nice to have your picture, and then tell them what your goals are and that you're on track to apply, when, and that you would like to come in for, this is important, 1 or 2 days of shadowing. If you insinuate that this is going to be a long, protracted relationship, that the doctors, that's just too disruptive to running a business. So just say, I would only like to spend 1 or 2 days, and sometimes they won't allow you to see patients with them because of HIPAA violations. So maybe the emphasis is you want to be able to just interview the doctor and get information. On the blog, I have an article I've written. It's called the Informational Interview. And we don't use it in health professions. It's a very, it's a used tool in business for shadowing. It's just, it's a lot of questions that you ask the doctor. So, and I've adapted it for optometry, like what questions would be germane to talk to an optometrist. So those are my tips on how to get in the front door, get your foot in the door.
A lot of the students that we see say they got their interest in optometry from their own optometrist. So while you're talking to your own when you're in for an eye exam, start talking to them about shadowing too. And all optometrists went to school with other optometrists, so use them as referrals to other doctors too.
I think that peer-to-peer mentorship that can involve a lot of you that are from Davis, big clubs, student organizations with pre-optometry. I work with our pre-optometry club at Ohio State with about 110 members. They work a lot with each other, and freshmen get tips from upperclassmen about OAT and what they did. It's powerful. You're getting great information from each other and sharing it. So being a part of these clubs, if you're at schools that don't have pre-optometry clubs in the room, start one up. That power of peer-to-peer and getting information from each other, working together with each other, it's a great skill set to have, and you're gonna really get from the horse's mouth how things have been going.
Okay, thank you. So going off from Dr. Munroe, since you brought up the HIPAA rule, I was just wondering how come some offices allow students to shadow while some don't, and like reason it is due to HIPAA rule.
Yeah, well, HIPAA violations are a consideration. I mean, I think it varies from doctor to doctor. And then there are some patients that doctors have had long-term that they know they would be okay to host a shadowing student with the patient's permission. But I think you have to be really respectful of that. It's no small consideration. Let me just say this. If you've seen an optometrist, you know what it looks like to give patient care. That's really not why you're there. I mean, you're all, in on the patient care part. You're not there at shadowing to learn how to run instruments or do tests. You're there to talk to the doctor about the profession. What's it like? Would you have done something different? What challenges does it face? What are some of the things that you just love about it that, you're very committed to? And those are the kind of questions you're looking for. So can I answer that in a roundabout way that don't overemphasize watching the patient care part of it? It's really talking to the doctor about the profession, joining the profession, and the lifestyle, and because most of you know what it looks like to dispense patient care.
If you work in an office for more than 2 days, and I agree with the strategy of getting your foot in the door and not presenting yourself as too intimidating a prospect to take on, but if that works out, frequently it can lead to a more protracted and more meaningful shadowing experience. So that's why you want to start light and try to expand it. But all offices have multiple staff members, and the staff members all come in contact with patients. So they've managed to be HIPAA compliant and still have multiple people in an office. You just need to become one of those people. That means you need to be trained in HIPAA, which is not a big thing. You can do it online. And you need to be a part of the team, and then you can have patient access. Initially it can be too much to expect to just be taken into the exam room and help examine the patient. I mean, that would be a massive noncompliance, and also probably not what you really are ready for. But it can lead to something more meaningful where you do pre-testing of patients, where you take histories maybe, or you escort patients. And then that doctor can write a letter that talks about your ability to manage patients, your interpersonal skills, your ability to work in an environment with multiple staff members. And that's a much stronger letter than Jane was here for 3 days and she really wants to be an optometrist and I think she'll be great. That's a throwaway letter. That means nothing.
And you have a lot to offer. You got a lot of gray matter and a big interest in the profession. A doctor, if he would, maybe, if this would lead to a part-time employment situation, even that, or an
Exactly.
externship, that would be great. It would be mutually beneficial.
Gonna retire in 4 years. The practice is yours. Graduate.
We've seen that.
happens.
Oh, we've seen
That
that.
happens.
Okay, thank you. This question is for Dean Van Sluyters. How much of an effect do the students' undergraduate schools have on their applications?
We get this question a lot at Berkeley because we have, I think, the highest average GPA among applicants. It makes people think that we pay a lot of attention to GPA. In fact, as I mentioned, I think earlier, we don't. It's a feature of our applicant pool, so there's a lot of self-selection. And a piece of that gaming the system to try to have a high GPA is doesn't matter where I went to school. And the simple answer is no. If you go to a small school, a community college, a junior college, or something like that, as typically happens here in California for a couple of years, and then transfer to a UC, finish up your education. I can't tell you how many people are at Berkeley now who did that and went to Davis, went to a community college somewhere and transferred in, or transferred to Berkeley, or transferred to San Diego. As long as the UC accepted your grades and your courses in lieu of courses they would offer, why would we not? I mean, we're a UC too. So, and then we extend that rule to all the other schools that people might attend. So if you take a course that's an analogous course, that's fine. Where things can get a little tricky is if you go to some very esoteric, very small four-year liberal arts college with a total enrollment of 65. Okay, that can be kind of hard for us to evaluate. And the simple thing there is we look at your OAT score. I mean, the OAT is the same for everybody in the whole country. And if you go to a good school, you'll get a good score on the OAT. If you go to a really weak school with lots of grade inflation, you'll get a bad score on the OAT, and there's no way around that. The OAT is a cumulative assessment exam. You can take a capital course, you can improve your score by 10%, and that's it. The rest is going to be based on what you learned as an undergraduate, and it's payback. If you went to a place with high grade inflation and you didn't learn much, it's really hard to do well on the OAT test. If you went to a good school and you studied hard, even though your GPA might not be so high, your OAT scores will. And if I could just take 1 second to talk about that relationship. And long ago, we noticed that relationship. And since a majority of our applicants are from the UC system, we noticed that it was typical for students at UCs to have a GPA, if you take the decimal point away, that was a lower number than their OAT score. So a cumulative GPA of 3.3 or 330 would lead to an OAT academic average score of 350. And it was that sort of gap where the OAT was always better. And then we started to notice that students that went to weaker schools, schools we knew were less academically competitive in terms of who they admit, would have a GPA of 3.5 or 3.6, a higher GPA, but an OAT score of 330. Okay, so the two flipped. So long ago, being a highly mathematical institution, we stopped paying attention to either of those two scores. We now just add them together and take the average. It's a completely illegitimate mathematical operation, but it works for us. It weights your GPA by your OAT score. And so it levels the field, and we think in a very good way. And that's actually the number we pay attention to. We don't look at your individual score very much. So what was the question? That's the answer, whatever the question was.
Okay, so this question is for Ms. Sunnie Ewing. Could you please describe the general admissions process?
It varies from school to school, so you definitely want to check with each school you're applying to. I'll use the standard disclaimer there. Basically, you start with Optomcast. It opens July 1 each year, so you want to start with Optomcast and then check in with each school you're applying to see what their supplemental application is like. Somewhere along the way, you're going to take the OAT. Most students are going to take it during the summer that they are applying. Every school, again, will have different rules on retaking the OAT, but if you need to retake, if you take it earlier in the process, it gives you more time to retake later on. Have your application, your letters of recommendation, transcripts, essay, all of those materials will be sent to Optomcast, and then supplemental applications with their supplemental materials will be sent separately to the different schools. Optomcast basically will process everything and forward it on to the schools eventually. And sometimes in the early process, because there's so many applications, it takes a little bit longer. But you want to stay in constant communication with the schools you're applying to. You don't want to, if you have questions about Optomcast, you want to refer those questions to Optomcast, not the schools specifically, because usually they don't have much to do about that anyway. So deadlines are different, processes are different. We use a rolling admissions at SCO. Other schools have set deadlines. Like Berkeley's definitely got a different process. He can share with their process. But for us, the earlier you get things in, the better your chances are of being accepted, because we have 130 seats available at the beginning, but when we get later to March 1, which is our deadline, there's very few seats available. So you definitely want to apply as early as possible. But you don't want to take the OAT until you're ready. You don't want to take the OAT just to get it done or to see what it's like. You want to make sure you have those prereqs completed, time to prepare, and take the test as a serious part of the application. I think in a nutshell, that's I think I covered most of it. These two did the presentation, I think, didn't you?
Yeah, since she alluded to the process at Berkeley, I think we're the only school that doesn't do rolling admissions, so I probably should say a little bit about that. I think all the schools start at the same time, right? July 1. So that's when applications open. And even though we don't do rolling admissions, it's interesting that we see a flurry of applications right away in July. And then things go very quiet for quite a long time for us. And that's because we don't stop taking applications until December 1st. And during that period, it matters not when you apply. We don't evaluate applications until they're all in hand. And we certainly don't make any decisions about who we're going to interview until we've seen the entire applicant pool. And then from the applicant pool, we select roughly twice as many people as we plan to make offers to. That's actually not quite true. We interview, 2/3 of the people we interview end up getting an offer, so it's not a 2-to-1 ratio. And then we invite everybody to be interviewed on the same day. Most schools couldn't do that. We are able to because our class size is not too big and because it's a whole school activity. We interview something like 120 people, and we have about 180 people involved, almost 200 people involved in doing that. That means most of the students, all of the faculty. We close our clinic, and we make it a whole day activity. And that way, all the students who are coming to Berkeley see each other on the same day. You meet each other. 2/3 of those people will be back in the fall, so you're basically meeting your classmates. And the experience is common. If it's raining, if it was hard making connections, everybody suffers from that. If somebody had a headache and didn't do a very good interview, an interviewer, everybody has that person, that sort of thing. A lot of our activities are done by students. We involve students very heavily in the admissions process. And so they participate on interview day. 2 of them sit on our admissions committee and have full voting rights among 10 members. So they're very involved in the evaluation process too. And then we review post-interview all applications based on not just what was on paper, but now what we know about you from spending a day with you. And then we make our decisions, and then everyone hears the decision on the same day. So there's no, did you hear, I heard, are they waiting? No, they're not waiting, that sort of thing. We think it's cleaner and fairer and more transparent. And as I said, if you don't get in, we'll tell you why. So that's, from our standpoint, it's a very student-driven process. It's hard for us to do it that way, but we think it's better. And our new dean has indicated he likes it too, and so I don't see any chance of it changing. I should say one other thing that's probably true at the university schools at least, and that is admissions at UC Berkeley, just like at UC Davis, is not an administrative function. The power to admit students to the University of California is entirely in the hands of the faculty. So the dean is not involved in any way. I'm not involved in any way. It's a faculty prerogative who goes to a UC campus. So therefore, the faculty have to buy into this, and since they're doing a lot of the work, have to support it, and they do. They think it leads to a better process. But it's a gargantuan and very labor-intensive endeavor.
Okay, thank you. This next question is for Mr. Griest. During interview, what is considered sharing too much?
Oh, boy. Okay, good question. Well, we obviously a lot of times start the interview off with, just tell us a little bit about yourself and this, that, and the other. And it's good to get some background of you. We've seen some things on paper, but a lot of the interview day is just to see who you are in person, how you would work with your patients that don't have anything in their mouth and talk to you. That's one of the things about optometry that's different than a lot of the other health professions. No surgeries, everyone's awake, it's not dentistry, their mouths are open. So we want to make sure we're making a good contact there. But telling too much, well, I guess if you elaborate on things and talk a little too much about sharing information about maybe a situation that you were in. Let me give you an example. Let's say there was some kind of a medical issue that you're talking about, why you became interested in optometry, and you went well above and beyond talking through it. That maybe would be sharing too much. Help me out here.
Okay, I recommend that you adapt a method. When you're asked a question, tell them what you're going to tell them, and then tell them what you told them. This is really good. When you're talking to someone that you have no context for who they are or how they're going to answer a question, like if I asked Justin, would you like tacos for lunch? You know, and I don't know if he likes tacos.
I do.
He's going to say, I love tacos. Tacos is one of my favorite foods. I love Mexican food. Tacos would be perfect for lunch. Tell them what you're going to, make your arguments, and then wrap it up, okay? Because what people do, nervous interviewing applicants ramble. And our faculty are trained, they just let you go, because that's part of, you have to be a good communicator if you're going to be a doctor, and to be concise in your communication. So tell them what I would start practicing that. I used to do that with myself when I was going to be interviewed. I would even brush my teeth and say, okay, I'm going to brush my teeth right now. And I would develop my arguments for what's involved in teeth brushing and say, so with these 3 definite techniques, I've learned how to brush my teeth. I mean, you can't do that enough. So that shows masterful communication. Come to the point, and then your conversation dies off, like I'm going to do right now, so the interview can go on and proceed.
So interviews come in 2 flavors. There's the kind that was just being discussed, which is a discussion, an interactive interview, free form. Sure, the interviewers will have some questions they're going to ask you, like, why do you want to be an optometrist? That's a pretty clear one that most interviewers will ask. But they're sort of wide-ranging subjects. And there you've got to have, a distinct, concrete answer and deliver it and move on. And you can get that way by practicing. So most schools offer mock interviews. There's software you can buy that offers mock interviews. There's a lot of things. Another reason for being a member of a pre-optometry club, they almost all organize practice interviews. And so you can get pretty good at that. The second kind of interview is something that medicine's used for some time, and optometry is just starting to use. It's called a multiple mini interview, MMI. So in a multiple mini interview situation, it's what Jane Ann was talking about to the max on steroids. You walk up to a room, you receive a card. The card says a statement that you're going to address, a question of some sort that you're going to address. You read it, you think about it, you go in the room, you have 5 minutes or 4 minutes or 3 minutes, you answer the question and you leave. And that's it. And you do that a number of times, 4, 5 times. We're using that in conjunction with interactive interviews to see how quickly you can actually do exactly what Jane Ann said. Think on your feet, formulate an answer, deliver the answer, make it make sense, and get out of there. And that's part of the kind of thinking and interactive communication process that doctors have to be good at. You're going to be confronted by situations multiple times with every patient where you have to be able to respond quickly, concisely, and move along, or you'll take forever to do an eye examination, and you'll just confuse your patients. So the questions are not hard. They're not, mathematical equations or philosophical conundra that you can't possibly answer. They're pretty straightforward kinds of questions, but you have to be able to think on your feet. They're not practice questions. You got to be able to answer them right away. So practice that. Practice being able to give a 3-minute answer to any question. And it's a skill you can acquire.
I would also say one of the things that might be sharing too much is freedom of language, not keeping it professional in your communication while you're there for an interview. That's probably one of the things when people are invited for an interview, if there's not professionalism shown in the interview, that's one of the things that keeps someone that's a really strong applicant from being accepted. Because if you're not professional in your interview, how are you going to be in the clinic with the patients? So communication is definitely something that's different from different ranges of the country. So you just have to be understanding of where you are interviewing at too.
And I think also in sharing too much sometimes is a body part. You want to make sure that you are professionally dressed, and especially for girls, you know. And actually, I'm sharing this because as I said before, 3 weeks ago or so, we had this occasion in which someone came for an interview with a very, very short skirt, and we also had we require a photo. We don't require, we ask for a photo. And once we received a photo from a particular student, it was a full body, and it was very hard to look at because the skirt was so short. And also during the interview, you know, as I said 3 weeks ago, a very short skirt, and then that becomes the focus of the interview. And it moves from academics to your experience to what was she thinking and things like that. So be very careful with professionalism when you dress as well, but to not share too much. There's certain things that are bad or not.
Okay, thank you. Well, before we ask the last question, does the audience have any particular questions that they would like to ask? Yes.
By very common, do you mean the majority of applicants are first-time applicants, at least at Berkeley. But I would say every year we have maybe 10%,
Yeah, I'd say
something
10
like that,
10%.
that are reapplicants. I think that's about right. I don't have the numbers before me, but so it's not real common, but it's not uncommon either.
Does every specialty that you mentioned require a residency, or can you go into
Good question.
Okay, first of all, residency, just to clarify, is a 1-year postgraduate program. You're not paying tuition anymore. You're actually paid a stipend to see patients, and you choose one of the residencies to go into. And your question, I'm sorry, is it required? No. That's something. I think you said half of your students go into residency. We're at 37%. I would think of it this way. Let's say I'm an optometrist and I'm going to go into general practice, and I decided to do an ocular disease residency. For 1 year of concentrated study, I would see only ocular disease patients. You could not get that in private practice for perhaps like 10 years. It really gives you a leg up. And then the other thing, so many, like, I'm a boomer and I'm in the time when I would be possibly selling my practice and retiring, or like, now I've been out of school, I'm going on, 40 years. So for me to hire a new grad right out of school that's done residency training, it gives my practice a whole new, you could, like, let's say I hired you and then you were an ocular disease specialist, I could refer all the ocular disease, follow-ups to you, and have that part of my practice covered, and then you would still practice general optometry. It makes you very marketable too as a new grad. But I just think, okay, so you asked if you would be really missing the boat if you didn't take advantage of a residency opportunity and then tried to hang your shingle and say, I'm a VT specialist or whatever, and you didn't do residency training. So, that would be like a medical doctor. They're licensed to do many, many things, but a general practitioner that went and did something very sophisticated like brain surgery puts himself at a lot of liability and risk because they don't have the training should anything happen. And so you just wouldn't does that make sense the way you do that? Yeah.
I would just add that there was an article recently in an optometric education journal, and the title of the article was, Should Residencies Be Mandatory? So just the fact that that article is entertained tells me that the future is clear. Our profession right now is pretty much where medicine was, general medicine was, prior to the development of all the subspecialties in medicine. Or if you want to take it a step further, we're where ophthalmology was when it first sprang off as a separate profession from eye, ear, nose, and throat and became just eye. So now we have ear, nose, and throat doctors, but the eye doctors became separate. There were just ophthalmologists. And as you heard probably this week, now ophthalmologists come in 5 or 6 flavors. So it's no longer enough just to be a resident. You also have to do a fellowship and specialize in ophthalmology and be a retina ophthalmologist or a glaucoma ophthalmologist or an anterior segment ophthalmologist. And general ophthalmologists are actually going away. The number of general ophthalmologists is dropping pretty steeply in the country. We're at the general optometry stage. With lots of interest in very discrete specialty areas and a growing number of residencies to support people who are interested in those areas. There are not enough residencies available for everyone to do one. They're actually fairly competitive right now to get a residency. I'm not saying they shouldn't be competitive, but if they're going to be mandatory, we need to develop a lot more residencies. So I think you will see, probably not in your time in optometry school, but in your lifetime. Definitely, that residencies will be mandatory for people who want to specialize.
As optometry scope, I'm sorry, I didn't mean to.
Go ahead. General optometrists will probably still exist, but they'll be like general ophthalmologists. They'll be very threatened by the fact that there are lots of people who are specializing that can take away patients from their practices.
As the scope of optometry expands, I mean, we're using therapeutic lasers, and, you know, and in some states we're licensed to do laser vision correction, surgery, suturing, injections, intraocular injections, all these things. And so, you know, our students in a general program are taught like venous puncture, vaccinations, suturing, you know, making and doing incisions. But you think, okay, so as the scope of practice, you know, expands, how are we going to answer demand in optometric education to get that specialty training? It's going to definitely be done in residency training. So, you know, we just can't do it all in 4 years of a general education.
Okay, well, this concludes our admissions panel. Let's give a round of applause to